Palpation of lymph nodes. To palpate the lymph nodes, the palmar surface of the middle three fingers must be used. Solitary lymph node involvement is common in local infections of mild degrees. Multiple lymph nodes, in different areas of the body, are involved in generalized lymphadenopathy, which is seen with extensive infection, immune system disorders, and cancers. The site of enlargement of the lymph nodes gives a clue towards the site of infection based on the area that is drained by them. Cervical lymph nodes are classically enlarged in tuberculosis and Hodgkin's lymphoma. Axillary lymph nodes, which comprise the apical group of lymph nodes, drain the breast and are therefore enlarged in breast cancers. The inguinal groups are enlarged in infections such as filariasis and lymphogranulomas. Raised local temperature is a sign of inflamed lymph nodes. Lymph node inflammation or lymphadenitis may be localized or generalized. Localized lymphadenitis involves one or just a few nodes that are close to the area where the infection started. Generalized lymphadenitis is when two or more lymph node groups are involved and may be caused by an infection that spreads through the bloodstream or another illness that affects the whole body. Tenderness on palpating the lymph nodes is a sign of inflamed lymph nodes. More common with localized infections of the salivary glands and tonsils. Tender lymph nodes may also be seen with secondary infection of enlarged lymph nodes. A smooth surface is seen in local, uncomplicated enlargements of the lymph nodes, such as tonsillitis or infections of the scalp. Rough surface is a feature of primary and secondary malignancies. Smooth, well-defined, easily distinguishable margins are a feature of benign enlargement of lymph nodes. Rough, ill-defined, infiltrating margins are seen in malignancies. To check the consistency of a swelling, roll the palmar surface of the middle three fingers against the swelling and maintain slight pressure. Lymph nodes may be soft and fluctuating, or elastic and rubbery, as seen in Hodgkin's disease. Firm, discrete, and shoddy lymph nodes are seen in syphilis. Stony hard lymph nodes are seen in secondary carcinoma. Variable consistency, which is soft, firm, and hard in places, depending on the rate of the growth, is seen in lymphosarcoma. Type: matted lymph nodes result due to periadenitis surrounding the lymph nodes. The inflammatory process results in fibrosing of the lymph nodes, together giving it a matted feel. A common finding in tuberculosis, although palpation may not be enough to confirm the presence of matted lymph nodes, a lumpy, doughy consistency with large enlargements must raise suspicion of tuberculosis. Matted lymph nodes are also found in lymphadenitis and malignancies. Fixity to skin, the deep fascia, the muscles, the vessels, the nerves, etc., is an important diagnostic clue. Any primary malignant growth of the lymph nodes, such as lymphosarcoma, reticulosarcoma, histiosarcoma, or secondary carcinoma, is often fixed to the surrounding structures. In carcinoma of the penis, the secondarily involved inguinal group of lymph nodes infiltrates the femoral vessels, causing hemorrhage. Upper deep cervical lymph nodes may involve the hypoglossal nerve and cause hemiparesis of the tongue, leading to deviation of the tongue to the same side. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.